Good morning. Thank you for joining us today. My name is Christina Linden, and I am the Health and Wellness Outreach Coordinator here at RX Outreach. Our mission is to provide affordable medication to those in need. So if you or anyone you know is struggling to pay for your prescriptions, please reach out to me or another staff member afterwards, or you can visit our website, www.rxoutreach.org, to see what medications we carry and enroll for free in the program. Today, we will be learning about identifying and preventing a stroke. This is just one of our weekly sessions in a series of free community health education webinars led by medical professionals and experts. These sessions are recorded and uploaded to our YouTube page, so you can go back and review them or send them to a friend. You can easily find us at youtube.com and search for RX Outreach. Our webinars would not be possible without our sponsors. Their support enables us to provide this resource to the community at no cost. Thank you to Anthem, Cigna, the Bridgeton Landfill Community Project Fund, Lutheran Foundation of St. Louis, and the Marillac Mission Fund. Thank you to them sincerely. Now I'll introduce our speaker, Paula Linden. She has 37 years of experience as a nurse. She's an RN, MSN, and an assistant professor of nursing at St. Louis Community College. Paula, thank you so much for joining us today. And with that, I will turn it over to you.
Thank you so much. I'm very excited to participate in this RX Outreach project. The mission for this outreach is phenomenal for the community, and I'm very grateful to participate in this. So what I'd like to start out with today is to go over the key learning objectives that we're going to discuss in this stroke awareness and prevention model. Okay, so what we're going to do today is we're going to talk about what actually is a stroke. We're going to identify what are the different types of strokes, what kind of signs and symptoms we're looking for, and what to do if you're having a stroke. So instead of talking about stroke prevention, we're going to talk about decreasing your chances of having a stroke. All right, what is a stroke? A stroke is something that happens in your brain when you're not getting the appropriate blood supply, which carries oxygen to your brain tissues. So one of the favorite foods of your brain is oxygen. And without that oxygen supply, the cells in your brain die. A stroke, I'd like you to remember, is a medical emergency, and it needs prompt treatment to be able to prevent brain tissue loss. And when a patient has brain tissue loss, they also have a loss of brain function. What I'd like you to know, which you may not know, there are two types of strokes. There's a stroke called an ischemic stroke, which occurs because of a blockage in a blood vessel in the brain, or an embolism, or a traveling blood clot that comes from a different part of your body and gets lodged in your brain. The second type of a stroke is called an aneurysm, or a bleeding stroke. So I will go into detail. An ischemic stroke is usually treated with a thrombolytic. So blood clots form within certain areas of your brain vasculature, as you can see there on the slide. We'll talk about the thrombolytics and how they're known to you as clot busters. That's the treatment used for ischemic strokes. And again, embolotic strokes, or an embolism, is something that if a patient has atrial fibrillation, a common heart irregularity, that can cause the heart to collect small blood clots within the heart. And as the heart rhythm is irregular, they can shower these clots up into the brain, thus causing an embolotic stroke. Again, treatment for the ischemic stroke is something called TPA. And what I'd like you to remember is there's a very short window of time to be able to receive that medication if you're having an ischemic stroke. So you'll hear, if you think of the cardiac campaign, time is muscle for heart, I'd like you to think of time is brain for a stroke, so that the longer a patient is experiencing stroke-like symptoms or having decreased oxygen to their brain cells, the more at risk for damage and loss of brain functions they are at risk for. So to receive the clotbuster TPA, there's a window of time between 4.5 to 9 hours from the time of onset of symptoms. A hemorrhagic stroke, I'd like you to think of this as a hernia in the blood vessels of your brain. So there's some pictures there on your screen. What happens is this can be more genetic, or it can be an outcome of untreated high blood pressure that causes weak areas in the vessels of your brain, where you can see then it balloons out in different formats, and then eventually it will rupture and cause that bleeding. That's what we call a hemorrhagic stroke. Bleeding in the brain, again, disrupts that oxygen flow to the brain tissue and causes the cell damage and death of the brain tissue. Again, it's more genetic related. So if you have a family member that has had a brain aneurysm, it's good to be tested to be sure that you don't have the same vessel irregularity that one of your either parents or siblings have had. Blood pressure is a huge contributing factor to hemorrhagic strokes. So uncontrolled hypertension is what weakens those areas in the blood vessel, causes that herniation, and then eventually the rupture of the aneurysm. It's very interesting how brain aneurysms are treated. So in figure A at the top left of the screen, you can see the normal vasculature of the brain. In B, you can see where there is a herniation or an aneurysm occurring. In the top right, you can see where the aneurysm is clipped in 3 different areas. Then this allows the neurosurgeon to go in and either place a coil inside the aneurysm or to ligate or make an incision and disrupt the aneurysm because it is clamped off. This does not cause a hemorrhagic stroke. And then the neurosurgeon can either put all of those clamps like you see on E, or do a bypass of that aneurysm port of the vessel. Thus, the idea is to prevent a patient from having that rupture and a hemorrhagic stroke. Okay, let's talk about risk factors, or what puts a person at risk for a stroke. The ones that we're going to focus on today will be in the left-hand side, called the modifiable risks, things that we can change. Non-modifiable risks, things that we have no control over, are our age, our biological gender, our ethnicity, our race, and our family history or genetics. Things that we can modify are our hypertension, and how we modify those we'll go into detail. We can take our high blood pressure medicine. We can decrease the salt intake in our diet, and we will talk about other healthy lifestyle choices further on in the presentation. Heart disease. So I talked a little bit earlier about atrial fibrillation. We can take our prescribed medication to be sure that to the best of our ability, we have a regular heart rate that doesn't put us at risk for this showering of clots that can cause a stroke. If we're diabetic, You might be thinking, well, how on earth can we control our diabetes? Well, the answer to that question is we can be prudent in taking our medication as prescribed and following a healthy diet that helps keep our blood sugar within normal. If we're smoking, now I'd like you to understand the pathophysiology for smoking. What smoking does is it's a very potent vasoconstrictor, that we call it in the medical profession. What that does is it makes your blood vessels very much smaller all over your body. So if you're smoking, the nicotine diffuses through your body and causes your blood vessels to be much smaller. This increases your blood pressure, your overall blood pressure. It also decreases the size of the blood vessels that transport the necessary blood and oxygen to your brain. So if you're smoking, think of it as depriving your brain of oxygen. If you're obese, this puts more pressure on your blood vessels, and you're going to want to maintain a healthy weight, which we'll talk about working with your dietitian and your doctor and maybe an exercise therapist for strategies that help you maintain a healthy weight. I also want to talk about something you may have heard of called a TIA, or a trans ischemic attack. People often refer to these as mini strokes. Some people might think that a mini stroke is not a big deal and you don't really have to pay attention to that. However, what I'd like you to remember about a TIA or a mini stroke, these are warning signs. Usually it's a short episode of change in neurological function, which I'll walk through what those symptoms are. That can be ischemia or lack of oxygen to any part of your brain, the retina in your eye, or your spinal cord. Please remember that these symptoms will last less than an hour, but they should be taken as a warning sign that you need to see your doctor, that you are perhaps having a precursor to a full-blown stroke. In the medical profession, we like to use acronyms that help people remember. So, physical manifestations of a stroke, there are several other things, but I'd like you to remember the word FAST, F-A-S-T. So, FAST is for facial drooping, meaning that one side of your face looks like that or is lower than the other. You can have arm weakness. Typically, it's just on one side. You can have speech difficulty, either slurred speech or the inability to speak. And then T is for time. You need to call 911 so that you can get the appropriate treatment fast. Again, time is brain tissue. I'd like you to understand too, there's left brain and right brain strokes. Some of you may not understand this. Usually in the physical presence of your brain, if you've had a right brain stroke, the symptoms of a right brain stroke are going to be on your left side. So it's opposite. If you've had a left brain stroke, your symptoms are going to be on the right side. So left-sided hemiplegia, meaning that either your leg or your arm isn't functioning like normal. The opposite side neglect, meaning if you've had a right brain stroke, sometimes patients don't recognize their left arm or their left leg. It's a very odd phenomenon. They also have some perceptual or spatial deficits. They can deny or minimize problems. They have a very short attention span, and they can be very impulsive. So patients that have had right brain strokes are at an increased safety risk at home because, again, they have lack of judgment, and they can be very impulsive. Left brain strokes are the patients that we see that have a lot of speech problems or aphasia, and we'll talk about aphasia. They also think more cautiously and have more of a mental slowness about them. They are also more at risk for depression and anxiety, and they have trouble with comprehension skills or critical thinking skills for language and math. Okay, so I kind of want to walk through what happens after you call 911 and why you should call 911 as opposed to driving yourself to the hospital. So when the ambulance arrives, they're going to prepare you to be the very best you can be physically when you present to the emergency room. So they're going to ask you a lot of questions that might seem odd. What's your name? What's the date? Who's the president? I'm sorry, I'd like to go back. Okay, so what's the name? What's the date? The president. These are all called neurological assessments. You'll get an IV started. You'll have some oxygen in your nose. They will put you on a cardiac monitor. And if your blood pressure is very high, they may give you some medication through your IV. You'll get to the emergency room where you'll see the emergency room doctor. Again, they're going to ask you all of these questions. What's your name? What's the president? What's the date? They'll shine a little flashlight in your eye and check your pupils. They'll say, show me your teeth. They'll say, squeeze my hand, push me away. They'll do the same with your legs. You will have multiple repeated tests of that. They're looking for tiny variations in your neurological status to see if you're getting better or if your symptoms are progressing. Some medical studies that you'll have at the hospital, the most important ones will be to get that x-ray of your brain. So that will either be a CAT scan or an MRI or something called an angiogram. They'll also do an EKG because remember I talked about the atrial fibrillation. Be sure that your heart rhythm is regular. They might do some carotid Doppler studies, which is an ultrasound of this vessel right here on the side of your neck to be sure there isn't any occlusion. They'll do an echocardiogram to be sure there are no clots in the vessels, clots in the chambers of your heart. They'll look at your labs for clot time. They'll look at your kidney function, your metabolic profile, and on rare occasions, a spinal tap. Okay, so I talked earlier about aphasia, which is difficulty speaking. This is typically patients that have had a left brain stroke. This is very difficult for patients because it inhibits their ability to communicate. So either they can't speak, literally cannot speak, or they can't understand the words that people are saying, so they have a processing issue. Another common form of aphasia is where patients say the wrong words. So if they're asking for water, sometimes they might say gift card or just inappropriate words that come out. This is very frustrating for people trying to understand what the stroke patient is saying and for the stroke patient themselves. So we'll have later in this presentation some tips for communicating with people that have aphasia. So with patients that have aphasia, we want to decrease their environmental distractions. So we want to have a calm, quiet environment. We want to speak in normal tones and volumes and nothing exaggerated like shouting at blind people. We want to communicate one thought at a time or one idea at a time. And we want to ask short, simple questions that typically can be answered with either a yes or a no. We want to look at how can we provide other forms of communication, such as pictures, hand gestures, like a whiteboard that they can write. We want to allow the patient time to process. We don't want to rush them, and we don't want to finish sentences or put words in for them. We also want to remember that if the patient is fatigued, meaning they've had like a long day of physical therapy, that the fatigue can worsen their aphasia. And ask the patient to repeat what they've said and don't get frustrated and impatient with them. It's far more difficult for the patient that has aphasia to communicate than the person that's trying to understand them. Okay, 7 tips, important tips for stroke recovery, and you'll see these throughout whichever stroke program you enter. We're going to increase exercise and mobility because a lot of times patients that have had strokes, they have physical or neurological impairment in either their leg or their arm or both. So a stroke can affect movement or sensation. So a patient that's had a stroke can either have an inability to move that extremity, or they can have a lack of sensation. Um, we want to work aggressively with patients that are struggling with aphasia. Usually they'll work with a speech therapist to not only help gain their ability to speak, but it also affects their swallowing and their ability to eat and drink without the risk of an aspiration or getting fluid or food into their lungs. We also encourage patients to get into a stroke support group. Stroke support groups have a plethora of information and helpful tips, not just for the stroke patient, but for their family and their caregivers. It's very important to know that brain changes happen after a stroke. You may have to simplify your routine, either for a short period of time as your brain recovers, or to learn a whole new type of routine depending on the severity and brain damage caused by the stroke. It's absolutely vital to have a strong support system with family, friends, or the community, because it will be challenging for this new lifestyle to get around. To some people, it affects their ability to maintain their current job. The person that has had the stroke might have some personality changes that can be challenging for family members and friends. It also helps you understand and make healthy life choices, like we talked about earlier, decreasing the amount of cholesterol in your diet. So the dietitian would help you with that. Be active, so walking, different types of exercises. Physical therapy will help you with that. Caffeine intake. A lot of people think that caffeine is a harmless drug, which it is a drug. Caffeine has the similar effect of nicotine in its ability to constrict blood vessels. So if you already have a decreased blood flow to your brain, you don't want to add caffeine or nicotine to that problem and further reduce the oxygen and blood supply to your brain. Again, I talked about smoking before. We want to decrease our alcohol consumption. There's some studies that show that it can damage, high levels of alcohol can damage brain cells. We don't want to increase damage to brain cells if we've had a stroke. And managing our stress level. So stress causes our body to release something called cortisol. Cortisol has an effect on our body where it increases the level of stimulants in our body. So our epinephrine, our norepinephrine, these stimulants in our body increase our heart rate and our blood pressure. So if we're having a problem with ischemic stroke or a hemorrhagic stroke, we don't want to increase our blood pressure and thus put us at more risk for complications of a stroke. So another very important thing that we do is we comply with the plans and the care of our doctor or our practitioner that they've prescribed for us, which includes taking our medication, setting realistic goals, and it's very important to remember that recovery is a process. It might be a faster process or a slower process for some. And then there's a fabulous YouTube video here where a patient talks about the different changes that they've had in their life because of a stroke. So if you have time, I would recommend that you watch that. It's a short video. So I talked about modifying risk factors earlier. Again, the ones that we can modify are going to be high blood pressure. We're going to take our medicine. We're going to reduce the amount of sodium in our diet. What sodium does is it draws water into your body. So if you're drawing more water into your body, now this is different than drinking water. So if you're drawing more water into your body, you can also be increasing the volume of blood in your blood vessels and causing a problem with hypertension. If you have heart disease like atrial fibrillation, you're going to want to take your medication so that you're not at risk for showering those little blood clots that can cause a stroke. You are going to want to monitor your blood sugars, because one thing I didn't tell you earlier is diabetes has a negative impact on your blood vessels. It can cause them to weaken and deteriorate. So instead of having a major hemorrhagic stroke because of a herniated blood vessel, you can have smaller hemorrhagic strokes because the diabetes and blood sugar that's out of control actually damages the smaller blood vessels or vasculature of the brain. Again, we don't want to smoke, and we want to limit our caffeine intake because of the constriction of the blood vessels. Obesity, we want to make sure that we're maintaining a healthy weight according to our physician and in conjunction with our dietitian. Also, studies have shown that patients that have untreated sleep apnea, again, you're decreasing oxygen to your brain when you're having that apnea or not breathing. So patients with untreated sleep apnea are more likely to have a stroke. Patients that have a sedentary lifestyle, so people that like to sit around for long periods of time, what that does is that creates a stasis or a slower moving of your blood throughout your body. If your blood moves slower, it's like a happy little party where your blood vessels, like your blood cells, like to stick together. So I'd like you to remember, a sedentary lifestyle creates an environment in your bloodstream where your blood can clot easier and stick together and thus produce an embolotic stroke or an ischemic stroke. So if you're up and moving and your heart is pumping and your blood is flowing, it's not going to get stagnant or slow and give it the opportunity to clot. Here are some resources or places that are stroke centers. So Barnes Jewish, here is the website. Mercy has a stroke center, SSM, Missouri Baptist, and here's the American Heart Association and Stroke Association for information about strokes and preventing strokes. So I hope what you take away from this presentation is how to identify signs and symptoms of a stroke. And again, we use the FAST acronym, a facial droop. If you're having any sort of weakness in your extremities, if your speech is slurred, and T is for call your 911 paramedics to help get you to a hospital that can treat your stroke. Again, remember that time is brain tissue, and brain tissue is precious. Any questions? Here's a resource and a link. And I just want to thank you for the opportunity to have this seminar webinar today.
Paula, thank you so much for joining us today. That was very informative, and we really appreciate your time and your expertise and that you shared it with us today. So thank you sincerely so much. To those of you viewing this, if you've enjoyed this webinar, again, you can view it on our website, share it with a friend at the YouTube page for RX Outreach. Also, again, as part of our mission, we see a world where everyone has access to the prescription medications that they need. And if you have struggled with a stroke or some of the related diseases that impact and cause risks for a stroke, RX Outreach does carry many of the related prescription medications in our formulary. To see if we carry your medication, you can visit our website, rxoutreach.org. Thank you again to our sponsors. We really appreciate your support. If you need any assistance with navigating insurance, paying your copay, you can also reach out to us for more information on how to get those resources. Thank you so much for your time today. I hope you have a great rest of your day.